Now, the treatment approach in viremic phase. Now, one thing should be remembered here is that there are papers that are suggesting that once there is viremia, this virus has to be eliminated by the an animal's immune response. So vaccination antibodies will not be able to take care of this, precisely for the reason that after vaccination the antibodies will develop quite late, and initially that would be of IgM type of antibodies which will be getting converted to IgG in the later stage. Therefore, considering this fact as an important fact that you have to allow the animal's body to overcome the virus infection or viremia, you'll have to see that you don't interfere in immunological response. And as I have said here, the indicator is fever, and then the calcium reactive protein, nasal discharge, and other things. For the first time, we suggested that we should also try antiviral. And as we know, we had seen that in human LSD syndrome, they had used acyclovir successfully. Acyclovir is an antiviral drug, which is available as injectable as well as in oral form for human patients. So we said let's try acyclovir, and the whole idea was to see that the viral load is brought to some extent so that the animal body would be able to overcome it. Because what happens if there is rapid multiplication of virus, because the immunological response is weak, then the virus, because of sheer the numbers, will overtake the immune response. And there, if you give antiviral drug, the virus will be killed, and then as the virus load comes down, the immune response is much better. So that was the idea behind starting acyclovir. When we suggested acyclovir, there was a lot of resistance from the government side as well as from the state government side, suggesting that acyclovir nobody has used, so we don't know what are going to be side effects. But since we insisted that as this is already available in human, it is used extensively without much side effect. Therefore, we should see whether this is going to be effective. So we must have used acyclovir in more than I think 5,000 animals now, and the response from the field vet was the moment they started using acyclovir in lumpy skin disease, the mortality went down drastically, and then we found that the recovery was also much faster. So starting acyclovir or antiviral drug as early as possible is important, and generally we say that if the body temperature is more than 104 degrees Fahrenheit, then it's better to start acyclovir. And another recommendation was if it is a calf, then you don't have to wait even if it is 103. And if calf is having initial nodules, straightway go for acyclovir. So we have got number of cases where the virus load was so much that the calves were having seizures, nervous signs, and almost the farmers had given up that this particular animal will not get up. Even large adult cattle also in very severe stage, were having very high fever, severe pneumonia and other complications. Once we started giving them acyclovir, we found very good results with them. One thing we insisted on all the vets was not to use non-steroidal anti-inflammatory drug like diclofenac or meloxicam. Earlier, people were using meloxicam very extensively right from the first day, and what was happening was because they were trying to depress the fever, the immune response was not getting mounted, and large number of cases were getting into second and third stage. So we said absolutely no cortisone, absolutely no non-steroidal anti-inflammatory. If there is high fever, we suggested that you can give simple paracetamol. Paracetamol can also be given orally because orally paracetamol in ruminant is absorbed to some extent, and there are also injectable paracetamol available, and injectable can also be given. So that was what most of the vets were following that. They were giving paracetamol simply for 1 or 2 days to bring down the fever to some extent, from say 106 to 104. And after 104, we told them not to worry, because fever is not such a big issue. What we need to do is lower. We have to see that the virus load goes down. Then check the severity of skin lesions. If these are few and mostly wild, then in that case just go for CRP, and if CRP is not very high, leave aside, because those skin lesions will resolve by itself. And some people suggested that there could also be bacterial infection. So we looked at some data where we found that if the CRP level was more than 300, in that case we suggested that that is suggestive of also secondary infection. So you might even try some antibiotic, and some long acting antibiotic were tried in some cases. But in most of the cases later on we told them not to try even antibiotic, because it's a viral disease, and there are other ways of getting rid of the virus. Usually the first phase remains for 7 to 10 days. But then we found that there were a lot of cases where initially we found that there was resolution. Then there was a phase of 7 days to 10 days where the animal was perfectly normal. And after that 7 days, 1 week or 10 days period, again there was severe fever. That is the amplification stage, where the viruses has now mounted a severe attack on the immune response. And that is where then the other complications like edema and cardiovascular signs would develop. So to simplify, in the first stage, it is the viremic stage. And viremic stage, we have to differentiate whether the inflammation response is too severe as to cause problem to the animal's body. And that you can do with the help of calcium reactive protein level. It's a very simple test which can be done at any medical laboratory, and that will give you an idea whether you have to give antibiotic or not, and whether you have to give paracetamol or other antibiotic drug. Second thing, we suggested to them that irrespective if it is cough, then immediately go for acyclovir injection for 3 days, 3 to 5 days, at the rate of 5 milligram per kg body weight. In case of young calves, we suggested that even oral acyclovir can also be given as follow-up. Whereas we know that acyclovir is not absorbed from rumen when it is given to adults. So we were insisting that at least twice acyclovir injection should be given for 3 to 5 days. And we got excellent results with acyclovir. So can I have the next?